We're going to give it one more minute and then we will start. All right, everyone, we're going to get this thing going. Hello and welcome everyone to the American Lung Association's Community Connections presented by Novant Health and Wells Fargo. I'm your host, Carrie Beal, Health and Wellness Reporter for Spectrum News. A few housekeeping items before we begin. The webinar is being recorded and will be available after the session. Please submit questions for our panelists through the Q&A button. We will do our best to try to answer all of them at the end of the session. We encourage everyone to complete the survey at the end as well. This will help guide us as we create future sessions. According to the North Carolina Department of Health and Human Services, research shows that up to 80% of a person's overall health is driven by social and environmental factors, and the behavior influenced by them, which is known as social determinants of health. These factors can lead to health disparities and poor health outcomes. Strategic interventions and investments in such areas as food, housing, transportation, and interpersonal safety in partnership with local community groups and healthcare providers will help us reduce disparities and provide solutions for better outcomes. We will do a brief introduction of our speakers since you received their full bios in our confirmation email. We did have a slight change in our panelists. Charnavia Montgomery is unable to attend. Caring will be represented by Rebecca Palmer. And with us today is Alyssa Dittner, a complex disease navigator and COPD program coordinator with Novon Health. Kylie Como, a registered nurse and manager with a community health worker program for Novant Health. And introducing Rebecca Palmer, she is the director of strategy and innovation at Caring at Healthcare Nonprofit. It's a healthcare nonprofit located in Charlotte, North Carolina. During her 13 years tenure at Caring, she has served in a variety of roles across the domains of evaluation, reporting, grants management, program development, health policy, and advocacy. She completed her undergraduate education at UNC Chapel Hill with a degree in environmental science and chemistry and has an MS in environmental health sciences from the University of California, Berkeley. Let's open up the conversation with Kylie Como from Novant Health. Kylie, what is a community health worker and how do you work with vulnerable patient populations?
Thank you, Carrie. So community health workers really are a unique and important role within our healthcare system. CHWs, they often have shared life experiences, culture, language, and ethnic backgrounds with the patients and the communities that they serve. So many times community health workers live in and around the communities that they serve as well. They're advocates and frontline agents of change. They really understand the social and cultural norms of the communities we're serving. So because of these unique aspects, CHWs can quickly build trusting, genuine relationships with patients. This gives them a really unique opportunity to reach really deeply within the lives of their patients, meeting them where they live, work, eat, and so on. Through successive interactions with their patients, CHWs can guide and encourage patients, along the entire journey. They really promote and support positive and healthy self-care and self-management, which then elicits powerful behavioral changes. There's a lot of research out there that demonstrates how a successful CHW can drastically reduce racial and ethnic disparities in healthcare in underserved communities and foster a really robust, meaningful communication with health and social care systems.
Thank you so much. And this next question will be for Rebecca. Caring is a nonprofit organization dedicated to providing health services for the uninsured, underinsured, or those lacking access to affordable, high-quality preventative health care. As the executive director of Caring, tell us about the health disparities you have observed in your community.
Sure, thanks. Caring is an organization in Mecklenburg County that serves about 8,000 residents of our community each year, and we've been in the community for almost 8 decades. And I will say that and I know we'll talk about this a little bit later too, that the health disparities that our work addresses and that the work of the other panelists address have been significantly exacerbated by the pandemic. And so I know we'll talk about that a little bit later too. But the other thing I wanted to mention here is that, and Kylie spoke to this a little bit, but that place really matters. So when you look at the population that our organization serves with access to care, so primarily people who are uninsured and low income, over 30% of those patients live in one of the 6 public health priority zip codes in Mecklenburg County. So these are communities with really concentrated poverty and a whole host of challenges around access and additional barriers that really impact our patients' ability to be healthy. And so that's where community health workers and other initiatives to meet people where they are really important. And I'll give one example here that has been, I think it illustrates what we're talking about. So when you look at our patient population, looking at, for example, current smoking status, about 9% of our patients report being current smokers. But if you disaggregate the data and look specifically at our patients who are living in these public health priority zip codes, looking specifically at our African-American patients as well, if you look at those two, sort of looking at subpopulations of our overall patient population, we see upwards of about 20% of patients who report being current smokers. And so that speaks to place mattering, right? That we know that the advertising for tobacco products is significantly higher in those communities. And so a whole host of challenges that are affected by place.
All right, thank you so much. And this next question is for Kylie. What chronic diseases are most prevalent among the patients you serve?
Our team sees a lot of patients with chronic disease conditions such as diabetes, high blood pressure, congestive heart failure, and of course, a lot of chronic obstructive pulmonary disease that we'll hear a lot about today. Sadly, many of our patients are living with more than one of these or other chronic disease processes as well.
All right. And Alyssa, let's bring you into this conversation. Kylie mentioned environmental factors as a key social determinant of health. As a complex disease navigator and COPD program coordinator, what are a few examples of environmental factors and how do these factors impact one's risk of getting COPD?
So I think that one of the common misconceptions about environmental factors or about what gives you COPD in the first place is that smoking is one of the major parts, but it's not the only. So I think it's really important to figure out where you live, how air pollution plays in the mix, where you work, are you being exposed to dust, fumes, chemicals on a daily basis? The lungs are extremely vulnerable because they're really the only internal organ that is consistently exposed to these environmental factors in the air quality. So when we have exposures to these different triggers, the chemicals, the fumes, all of that wears on the lungs, and we're all different genetically and structurally, so our bodies can only tolerate so much. And over time, being exposed to these triggers actually wears down the body, wears down the lungs, and it starts to decrease the lung function. A lot of people see this when they're older, but we'll talk about this a little bit later, and I'll give a couple of examples about patients that I have seen who are in their 50s or in their 40s.
And you kind of touched on this question, but we often see COPD with smoking, but can non-smokers also get it?
Absolutely. That is absolutely. We tend to see people who are in more high populated areas, dense cities will have higher amounts of patients with COPD, even in rural areas, if like farming areas, all sorts of things can cause COPD. And I think that's one of the things that it's so important that people need to understand is it's not just smoking. So if you smoke, you might have a higher chance of having COPD, but if you don't smoke, that could be a possibility for you too in the future.
And do the populations you serve have a higher likelihood of complications from COVID because of these social determinants of health?
So COVID is an equal opportunity infector. However, there are numerous accounts of data that show the virus really does have a greater impact in these lower socioeconomic groups. The risk of developing a chronic disease is higher in these groups due to limitations, as Rebecca had mentioned, access to healthcare, finances, transportation, poor health literacy, all of these things really take a toll on someone's health that might defer their care and make their disease process greater in the future. So when it comes to COVID, a lot of people, they don't know that they have these chronic diseases. They often put off seeking that care, and then their chronic conditions left untreated. So that definitely puts them at a higher risk of becoming severely ill with COVID and having lasting effects. I'm going to give an example of this. So I met a patient who was in his early 50s, and he grew up having childhood asthma. He never received proper management of that asthma because of his social economic backgrounds. And as an adult, he continued to have that exposure. So he continued to be exposed on a regular basis to dust, fumes, solvents, all of those things that would be that inhaled irritant. And he never received any diagnosis or had any concern that he had a chronic condition. So then he presented to me about 6 months post-COVID, and he was recovering. And he was still overall very deconditioned, very short of breath, requiring oxygen. And he was very discouraged because, why was it taking me so long to recover? Why have my family members had COVID and they're not going through the same thing as I am? And really just kind of explaining to him, and finding out and doing a deep dive into his background and finding out that he did have asthma that was uncontrolled. Just really how that all affected him as an adult, and just really made the perfect storm for COVID to wreak havoc on his body and accelerate the lung damage.
And Alyssa, I have a follow-up question to that. How often do you see patients who go a good portion of their life without being diagnosed with asthma or a condition like it?
Yeah, well, it seems that we catch them sooner or later. I have seen just today somebody who is in their late 50s and having stage 3 COPD, never knew that they had COPD their whole life, but really everything comes to a tip, right? And all of these different things, your lungs affect your heart and your heart affects your circulation, and all of these things work together. So it might not be that they come in with a specific problem like COPD, but maybe they come in with heart failure. And we kind of figure out that, okay, he has this one thing happening, but really you have a whole list of other things that if we could have managed or helped those other aspects of it, then we could prevent other things from getting damaged. So it's really important to help intervene as caregivers and really see what we can do to stick ourselves in these situations so we can help to break those chains.
Yeah, that's really good information, recognizing the symptoms and doing something about it. All right, Rebecca, I want you to talk a little bit about Caring and what it's doing to address COVID among your clients.
Sure, absolutely. And just piggybacking off of what Alyssa shared, I couldn't have said it better in terms of the importance of access to preventive services and chronic disease management for everyone in our community, independent of health insurance coverage, socioeconomic status, because we know that left untreated, the challenges for our patients and for our community are so much greater. But speaking specifically about COVID, I will say that one of the things that it's important to note here at the outset is that the patients that we serve, many of whom being essential workers who didn't have the ability to or the sort of economic protection to stay home and quarantine in any circumstances, we're really impacted by COVID from the outset. We saw in the that first year of COVID, about 15% of our patients were receiving care from us for a COVID diagnosis at some point. And so being able to connect with patients and pivot really quickly to telehealth and other forms of access to care to maintain continuity, particularly for chronic disease management, was really, really important in order to to both help just maintain quality of life, but also to mitigate some of the complications of COVID, certainly. And so that meant really thinking about the way that we deployed those services such that we wouldn't increase or exacerbate already existing disparities. So wanting to make sure that everyone had access to telehealth services independent of internet access or being really flexible to meet our patients where they are to maintain that coverage. And of course, another really important piece of that is the financial aspect. So, one of the priorities for us was making sure that ability to pay was not prohibitive of access. And so both for preventive services and also for follow-up care, access to specialty care. The other thing I'll note too, specific to COVID, is that in the last 2 years, especially in the last year, we have seen about 20% of the referrals that we make to specialty care, to pulmonology, for post-COVID conditions. And so particularly for the high-risk patient population that we serve, it's so important to be able to provide access to not just preventive care, but ongoing access, care coordination, and support for access to specialty services, particularly for patients like that, struggling exactly like what Alyssa spoke to with the patient with COPD.
In closing, the social determinants of health gap can lead to improved chronic disease outcomes among people experiencing health disparities and inequities. Let's talk a little bit about what's being done individually, locally, and statewide to improve outcomes. I know you touched on that a little bit, but more, locally and statewide, what's being done.
Sure, for me.
Yes, that's for you, I believe. Yes.
Yeah, absolutely. So in terms of, I will say that our partnerships, because having a robust healthcare safety net with multiple access points for patients is so important. So our partnership with both health systems, for example, our ability to refer patients to Novant for access to specialty care has been so important to remove those barriers to care, so that patients are able to sort of seamlessly access care at the time that they need it, to avoid having to waiting until something is, like Alyssa said, so bad that someone ends up in the emergency room. And so part of that is also, in addition to the access, it's meeting people where they are. So looking at community-based initiatives, being present in communities, utilizing community health workers, like Kylie started out talking about, people living and working and learning in communities who are trusted voices to help address some of the sort of persistent mistrust.
All right, and Kylie, tell us what Novant Health is doing as a healthcare system to eliminate barriers to health and how success is measured.
Sure will. So one of the things I'm most proud of at Novon Health is the work that's being done to really truly understand and address social determinants of health, right? So we know it's not just about taking your medicines on time or visiting the doctor when you're sick or going, to that one well visit every year. Our patients' health encompasses and is impacted by, really their day-to-day lives, as we've heard here. So again, it's our focus as a healthcare system on those social determinants of health at an individual patient level. That's important. So as healthcare providers, we're experts at providing health-related care services. So, as we look to provide whole person care and address those social determinants of health, it's become more about collaboration and partnerships. This panel today is a great example of what I'm talking about. In the past, healthcare systems and other institutions or organizations often operated in silos, right? Closed off from competitors or rivals, while trying to support and manage the health and well-being of their, respective patients and communities. So we've all recognized that, collaboration really is the key to empowering individuals and communities and equipping them with the tools and the resources necessary to achieve healthy outcomes and an improved quality of life overall. So, with programs like the Community Health Worker Program, we're looking to take what we do so well and bring it outside of the four walls of our facilities and clinics and bring that whole person care directly to our patients and community members, specifically to those in those under-resourced or underserved areas. And in doing so, we've been able to gain really powerful insights into patients' lives. Programs like this provide a conduit for the voices of our community members. We need to continue to more deeply understand the health and wellness needs of our patients, what's truly important to them, and then together develop a plan on how to achieve those goals. So, with this approach, how do we know what's working? So, well, speaking from my experiences with the community health worker program at Novon Health, we assess our patients when we first connect with them, and then again, when they complete our program many, many weeks later. And we've consistently seen significant decreases in things like emergency department utilization and hospital readmission rates, as well as improved scores on things like depression scale assessments and measures related to how patients perceive the quality and coordination of the care that they receive.
Great, thanks so much. And Rebecca, I think you already answered this next question, so I'm going to skip to how is Caring collaborating with other organizations to address this issue?
Yeah, so this is really critical. And an example I can give is some of our work really trying to bring the services that we provide to communities, meeting people where they are. And so we have really been very intentional about developing partnerships, really trusted community partnerships with community-based organizations that are on the ground in communities, and working together to address the needs of the communities, the people who live in those communities, and being very intentional about engaging the community in that process. And so one of the communities that Caring has been working really closely in for years now is the Greer Heights community. And that is a very intentional meeting people, providing services there, whether that means a nurse who becomes a trusted resource so that people can come drop by the community center and get their blood pressure checked and talk about barriers they may be facing. That's been really important to sort of building up this robust healthcare safety net. Our partnership with Novant and Atrium to connect patients with access to specialty care, hospital-based care, really critical to making sure that people have comprehensive access to care.
That's good to know. Access is a big issue.
Absolutely.
And to create meaningful and lasting change and address persistent health inequities, states must focus on the social and economic factors underlying disparities. Alyssa, what policies have you seen enacted to specifically address better lung health outcomes?
So this is the good part. All the things, all the changes, it's definitely taken a while. But in the last 20 years, we've definitely seen some great changes and improvements for people and lung health in the community. So in 2002, North Carolina enacted the Clean Smokestack Act. And so that was established to reduce the emissions and pollution that was released into the environment. The Clean Air Act, that is a federal law that was enacted to reduce air pollution nationwide. And then we have the Tobacco Control Act signed into law in 2009. So this gave the FDA the authority to regulate manufacture, distribution, and marketing of tobacco products, which is huge. And then in 2009 as well, the Family Smoking and Tobacco Prevention Act. So this was to ban different flavors of cigarettes. And in 2009, they still had menthol that was included in there. And then in April, which is fantastic news, in April, they're pursuing the law or the rule of eliminating menthols as well. So as we know, menthol was highly advertised for people who are African American, and that is a huge group of people who smoke. And Rebecca had given you some of the numbers that she had seen, and it's a great thing moving forward.
Really good to know. And I know a lot of people are following that right now. So this has been a great dialogue. We want to open up our conversation to the viewers. So please make sure to submit your questions in the Q&A button. We'll do our best to answer all of them. We are running a little bit out of time. We have about 5 minutes left. So I'm going to start with Amy and Pam. They asked about the impact of vaping. And can you tell us what is being done to reduce vaping, especially among targeted populations like minorities and teens? Alyssa, I think that one's for you.
Yes, unfortunately, vaping is an epidemic and it is addicting a new generation to nicotine. So to combat this, we have to get creative. How are you going to get a teen who is doing this maybe for popularity, and they're so vulnerable at that age. So there is an app, or it's called Vape Free NC, and that is allowing teens to enroll in this program confidentially, and it has access to coaching on how to quit. It's got fun games and videos and quizzes, and it really has that little unique spin on really gathering their attention and hopefully holding it. They also offer the same type of education for parents. So it's important to really educate the parents about what to do when you see your kid smoking and how to approach the subject. Schools have substance abuse education programs that include vaping now. The North Carolina Quit Line, they serve a variety of minorities and others in the higher risk factors, such as expecting mothers, American Indian, people who are maybe have behavioral health concerns, or even people who are in active duty. So I think we are well on the way, and there is a lot more work to do, but I'm definitely excited.
All right. Thanks so much. And several of our guests would like to know what is being done to curtail the high cost of medication. Rebecca, can you address this question?
Sure, absolutely. I can do that quickly. So one of the things that we do for our uninsured patients that is really critical is connect them with North Carolina Medicist for access to their formulary. The other thing that our nurse case managers in particular are focused on is working with providers to know what medications are affordable and maybe on like a Walmart $4 formulary or something like that. So often when patients are prescribed a very expensive new medication that maybe there isn't a prescription assistance program for, we can work with that provider to identify another medication that may work for the patient, but is more affordable. And so maintaining that sort of open communication with providers, and also supporting patients to ask, to share with their provider when access to a medication is a limitation. And often they can work together to identify a more appropriate or an equally appropriate medication that is affordable.
Thanks so much. And I do have one more question I want to try to get in here because I think it's a good one. Marcus had a question about what programs and efforts are available in more rural areas. We talked a lot about the Charlotte Metro, but he's wondering, what programs are out there to help those in, areas outside of the Charlotte region. That might be Kylie, or it'd be Rebecca, I think.
Yeah, I mean, I know, speaking from my perspective, I know at Novon Health, we operate across such a large footprint, our rural community is very important to us. So it's really about access. So we've been trying hard to really attract physicians and specialty providers. We've really increased our mobile unit health, outreach in those rural areas. And then again, hate to toot my own horn, but the community health worker program, really embedding people that live and work and know those areas into those areas to create that bridge between our healthcare system and the patients that tend to have a lower rate of healthcare access, just because of where they live. Yeah.
All right. Well, thank you guys so much. And we are running out of time, so we want to conclude this session. We want to share important resources regarding social determinants of health and disparities. American Lung Association is committed to reducing lung health disparities for all Americans. They offer resources to help educate and ultimately improve outcomes for better lung health. American Lung Association is proud to partner with organizations like Novant Health and CareRing to implement changes throughout North Carolina. For more information, visit the websites listed on your screen. We will include this information in a follow-up email, so make sure to check your inbox. And this has been a great conversation. We want to thank you all for attending today's Community Connections. I hope you found it informative, and a special thanks to our presenting sponsors, Novon Health and Wells Fargo. We are grateful for our panelists for their time, insight, and service. Again, their names are Alyssa Dittner, Kylie Como, and Rebecca Palmer. Please remember to complete the survey. Your feedback is very important to us, and check your email for a recording of this session and additional resources. Thank you again, everybody, for attending. Have a wonderful day.